Good day. My name is Daniel Joseph. I am from Nigeria. I'm a caregiver. Um, some of the places I've worked and the experiences I have gathered as a caregiver, I have worked in a company for some couple of years whereby I do take care of elderly people. Most of the people I take care of, they are mostly elderly people. And I did as much as I could to make sure I give them the best care that they deserve. And elderly people, um, their body are very soft and they are already aging, so you have to make sure that you pay proper attention to them. Be very soft with them. Be very very polite, and whatever you are doing, you should also make sure that you take good care of them in a very um, cool and calm way, because these are old people that deserve a proper care, and you have to be very very soft with them when taking care of them. So most of my experiences, I make sure that I do the necessary things I need to do to take care of them. When it comes to the time that I need to provide them with their meal, I give them the appropriate meal. Make sure that they take their diet, those that are on medication, give them their drugs at the right time, and those both hygienic, both checking of their vital signs and everything that they need to, I need to do for them as a caregiver. I make sure I put in my best, and where I've worked so far, I've really been doing an excellent work, and my job speaks with so much volume because I make sure I do everything I can with so much passion for the love of the work I am doing, which is a caregiver work. How do I handle challenging or difficult behavior from a client or patient? One of the way I can handle a difficult or challenging behavior for a client or patient is to stay calm. I have to be very, very calm to understand why that patient or client is reacting or behaving that way. So I don't take that situation personally. I have to make sure that I am very soft, be patient, and listen to know why the client or the patient is behaving in that manner. So by so doing, I can be able to phantom um, a way to follow up with that situation at that moment. And again, I have to pay a proper attention, listening to the patient um, to know why he or she is acting in that manner. So by so doing, I can be able to pick out to know, oh, this is the reason why he's reacting this way. So I don't take the behavior of that patient or client personal. I make sure I do in my best to handle the situation and make sure that the patient is properly taken care of and make sure the patient is calm. So I make sure I show a empathy, make the client know that okay, I'm here for you, and no matter the situation, I'm here to make sure that I do my best so that you can be fine. So those are some of the ways that I can take uh, resolve a challenging behavior or difficulties from a client or patient. Okay, how do I keep effective communication with a client, their family, and with the health team members? One of the way I can do that is to make sure that I am very friendly. I'm friendly. Make sure I treat everybody nice, because they say that it only takes friendship to build a relationship with people. So communication cannot be done when you are not friendly. So I have to make sure I'm friendly with my patients, their family, and also my team members. I have to make sure that I'm also friendly with them. I also make sure I'm outspoken. Try to find out if there's any issue that they're having, if there's any way I can come in, if there's anything I can do to help. I also make sure that I show passion, compassion, and make sure that they know that I am here for them and I'm also part of their team. So when it comes to client, I also make sure I give him my best. Let the client know that I'm all here for you. I'm here to make sure I give you the best. I'm here to make sure that I take care of you. I'm here to make sure that I do whatever is necessary to give you the best health care that you deserve. So that's how I can keep effective communication. Whenever I discover that there's something that is not right or there's something going on that needed my attention, I try to um, talk to them and know what I can do for them to help. So communication matters a lot, and friendship, to build up that communication, is one of the stepping stones before you can have an effective communication with anybody. So those are the areas that I can be able to keep a good and effective communication with my clients and also with my health team members. How do I maintain a comfortable and safe environment from a client or patient? How to maintain a comfortable and safe environment is to make sure that I give him my best and put everything in place that's supposed to be put in place for them. I make sure that whenever they need my attention, I'm always there for them. Ask them what they need, treat them with a lot of good hospitality, because hospitality matters a lot when it comes to taking care of people and creating a comfortable environment and a safe environment for people. You have to make sure that you treat them the way you're supposed to treat your own self. So whenever they need my attention, I'm always there to make sure that I show them, um, I give them proper attention and take good care of them, and make sure that I'm also friendly. Ask them what they need, if in case they need anything, or anytime they need my attention. So those are some of the ways I can create a safe environment. Let them know that I am here for them, and whatever they need me to do for them, to take care of them and to give them a proper attention, I do my best for them, and also put everything in place. Make sure the environment is okay, conducive, hygienic, and make sure everything is okay. So those are some of the things I can do. My attention is also very, very important for them as well. How do I handle a stressful situation or emergency that may arise when during my caregiving? One of the way I can do that is to make sure that whenever there is a stressful situation or emergency that arises, I have to make sure I'm calm and focus to know what is the situation at hand or the emergency. I don't have to panic, because the moment you panic, that is where you get it off. Because patients are very, very sensitive, and their care and everything is on you. So you have to make sure when they are in a situation, you are calm, you are focused, and you are tactic. Make sure that with you are very, very sensitive, and make sure you follow up the situation like immediately. If it's a situation you cannot handle by yourself, get the necessary people or teammates or management involved, and let them know about the situation that is at hand. And if they are far away from you, you can get them on telephone call and let them know that, oh, this is what is happening and how do I handle it. So if there's something you can't handle by yourself, you have to make sure you get the appropriate team members involved so that they can handle that situation at that moment. So you should make sure you are focused when there is an emergency. Be focused, don't be distracted, do not panic, and get the appropriate team members involved when necessary. So make sure you do all possibility to handle that situation as soon as possible, because a thing of emergency is not something that should be taken slightly. You shouldn't waste time. So make sure you do the appropriate thing at the right time. And the people who are supposed to be involved, get them involved as soon as possible. And do not panic. Make sure you are focused and make sure you do the right thing and follow up on everything the way you're supposed to do. So in summary, as a caregiver, you have to make sure you are passionate about your work, make sure you are focused, dedicated, pay a lot of attention to your client or patient. Do not rush, do not panic, have empathy. Make sure that you are always there for your client or patient. Make sure that they feel safe around you. Give them the necessary health care they need. Be very hygienic. Make sure you check their vital signs. Make sure you feed them with the appropriate diet that is recommended for them and when necessary and at appropriate time. Those under medication, make sure they take their medication at the right time. Make sure you take good care of them. Do the necessary thing they are supposed to do. And above all, make sure you are always friendly. Be friendly with them. Treat them with passion. Put on a smiley face. Make sure that they have this sense of comfortability and safety around you. So that's how you can be able to handle and take good care of them as a caregiver.